as I keep talking about this, I do think there's this issue with like, can we separate the two? Because insurers, to their core, are large banks. That's their business model. They're going to hold on to money, most likely from employers, right? They're getting a ton of cash from employers up front, probably based on the quarter. They're going to hold on to that money as long as possible and collect interest on it. And they're going to hope that their actuaries said that they should collect in premiums, right? They're going to collect in premiums. It's going to go up 5% this year. They're going to collect that much money. They're going to hold it. They're going to hold it as long as they can because that is their business model. I'm not faulting them. I'm not saying it's right. I'm not saying it's wrong. I'm saying that's what they're going to do because they're banks at this point. And then they're going to pay out claims over time. Again, holding as long as they can. And you could see where this is trouble, right? Trouble is, in fact, like, this is how they actually make money. And trouble is in like, well, what happens in 2020 when the pandemic hits and they shut stuff down and they're holding cash for long periods of time? Now, we put in things like medical loss ratio. You've probably heard of this, right? Where they can only have to spend 85% or 75% of their total amount they collect. They have to put on claims. They have to pay out as far as medical services. But that also has its issues, right? So if I have my issues, and this happened to me the last few times. For 8 years, I've had my own insurance. I got it through the marketplace. Thank God it exists, to be honest, for people like me. And Blue Cross of Michigan sent me back a check at the end of the year saying they didn't hit their medical loss. They didn't hit their MLR, right? And they explained it. They sent me a check. And I'm like, okay, fine. I get it, but like, just keep my premiums low. Don't send me a check, just keep them low. And then what happens this year? I got a check at the end of the year, and I had a 15% increase. I went from $1,700 a month to $1,900-something a month, right? That's crazy. And especially for a family of four, relatively healthy. Like, it's pretty wild to think about. And now luckily I've afforded the ability to do this, but like, think about other people. But if we think of the concept as like, insurers are the banks, they're holding your money. And I think that's important. It's important because I want to talk about the employers. Now everyone asks like, how do we solve this issue? Right? This is kind of the constant, like, okay, you've described the issue with like hospitals paying, right? Hospitals being these subprime lenders. I've described that issue. I just 2 rants ago, I think I described how we got here. But like, how do we solve the problem? And I think Cuban isn't far off. And one of the things he's said multiple times is that the employers have the most amount of power. We think it's the government or insurers, and I've always said that like there's too many disparate parts, too many people with incentives for it to fail, or for it to go to universal health care comes up a lot. Well, why don't we just go to universal health care? That's the answer. It's like, or is that's going to happen, right? And I always get asked this, and I'm like, there is no scenario in which that's happening because there's too many people that have invested interest in like not happening, right? And you think about the lobbies associated with all this. There's too many lobbyists, and American Hospital Association is one of them, right? Like, everyone kind of see this writing on the wall. So I do think those individual, like, lobbyists, like the device manufacturers, the pharma, you think about insurers, the American Physician Association, they all kind of, like, push their things, right? Even at the state level, you see like, state health associations. But what I really think is like the largest impact is if a big employer started to be like, we're not doing this anymore, and we're gonna, because I'm already paying for it, right? Think about the dynamics of a self-funded employer. The self-funded employer is someone who pays for everything. Whatever happens, they're paying for it. And they're using these third parties They call it a TPA, a third-party administrator, like United. They're using a insurance company to run it for them. But it's widely estimated that insurance companies taking 20 to 30% to do that. Now, that's real money. And so Cuban kind of lines that out. It's like between that and paying cash pay, I think there's like a 40% savings. And I don't think he's that far off. Now, logistically, how do you pull it off? I don't know. But I do know that employers, if they would kind of skipped insurers and they went directly to health systems, my guess is they could cut out just a sheer amount, a crap ton of administrative burden that's on the hospital. And if there was a way to do this where it's submitting claims kind of the same way we do now, but they have but see, this is where I think AI could change everything. Because we could create the AI system, and I'm not trying to create another business model, but I think could be this business that's actually like, they're just really creating the technology that employers can put in their reasons why they might not pay a claim right away and have someone review it, right? I don't think it takes that much to be pretty darn good at knowing like when to pay something and when not. And if you think about another, you create another 10% for fraud, right? So someone's kind of auditing things, making sure hey, we're just on the up and up. That I think is solvable. And I think it's solvable at a scale that could be, once a few companies do this, I think it's solvable on a scale that you could do much larger. Because I think about all the things associated with like, I'm working through this insurance company, I'm negotiating this terrible deal, and they're much smarter than I am. But if I cut all the BS, and part of the BS is like the charges. I got asked this week from a friend of mine around charges. He's like, why do I see this bill? And this is what happened on my post, right? Just all kinds of people confusing charges at a health system with reality. And as we know, anyone in this business knows, charges are irrelevant for 95% of everybody. And they should be irrelevant for almost 100%. And my friend's point was, he's like, well, the thing is, like, on my bill for my EOB for my insurance, it says, like, look, we negotiated it. He goes, it makes the insurance company look like they're heroes here because they took off a $5,000 bill down to like $1,000. And he's like, they look like heroes. And I said, I know, but it's not reality. No one's paying that number. And there's a whole reason we talked about before about how we got to like charges the way they are. But think about like, if we could actually figure out what real cost is at the health system level, which I do think AI could help, and I think we could kind of make that a thing where we know with real certainty what our costs are, right? And I think if we could separate services, and this is going back to my point from the last one, around we have created insurance products that are kind of blanket covering all kinds of stuff, from preventative to emergency to catastrophic. But if you could create 3 different ways that you're contracting with the health system, one in emergent things, right? And let's say you're a large employer. I don't know. Let's say you're Apple. Apple's a good example. And I have most of my people, let's say in San Francisco. So I've contracted with the San Francisco health system. I've contracted with them on maybe with some physician groups, right? Or the health system, because they have large physician groups, to manage all this preventative stuff. And I'm going to do a bunch of stuff here because I want to keep my workforce healthy. And maybe that's like a capitation, right? And then you do an emergency services where it's more on a claim-by-claim basis. But I'm covering it, and I know where the people go. And my employees know where to go. Because I'm constantly keeping them informed. Hey, if you've got these types of things, and maybe I have a little AI agent that helps diagnose for them or tell them where to go. Hey, you should go to the urgent care. Here's 5 that exist. 5 that are open right now. Here's the waiting times at each. Or actually, this feels very emergent. You need to go to the ER, and here's 2 options or 3 options. Here's the waiting times, right? This isn't like that far-fetched. Waiting times exist right now at the ERs. And then we have this third option around catastrophic. And this is where I actually think employers should have insurance as stopgap. because they do not want to be stuck with a $20 million burn case, right? It just happens. These things happen, and they're going to happen, but you should be covered. If you had all three of those lined up, and you had kind of let's just call it the AI agent that helps with like making sure the claim is, everything's in the up and up, which these things exist, could be done pretty easily. And the employers already kind of figured out with the health system on three different things, they figured out how to make it so that it's like the lowest possible cost. If I'm a hospital, I'm 100% doing this. There's no scenario in which I'm not trying to figure that out and getting it to a price that would cut out United, Aetna's of the world that I don't need. And if I'm Apple, I'm doing the same freaking thing, right? Because I don't need to someone else tell me my insurance is going to go up by 10% when I know for a fact it hasn't gone up that. Because I know my numbers. I know exactly what I'm paying for maintenance, preventative, right? I know exactly what I'm paying for emergent because I'm paying the bill. And I know exactly what I'm paying for catastrophic, which is probably a combination of, let's call it deductible, total, right? And the total associated with the insurance you're going to do on the stopgap or catastrophic loss. Then you could figure out how much you're doing as patient share, which I've already talked a fair amount about. Patient share being that is not helping. I don't think it's helping on the cause of, I think patients should pay something, but I also think like it should be the preventative piece and it should be part of the process. Not like, I don't know where this money's coming from or how it was figured out or am I spending that, right? Like it's so nebulous. And almost this is why we can't collect anything because it just feels like, well, I don't know. I thought my insurance was covering it. But if I know my insurance isn't covering it, and I know where I get my services from, I actually don't think people are going to push back that much. And sure, there's going to be exceptions where it's like, I got to see this doctor for X. Fine. Like, they'll have to figure that out. But I actually think that one of the major issues that we have created in the U.S. is this blanket system that's supposed to cover everything. The reality is it's not that simple. And if we could separate the three, I actually think employers could make significant reductions in how much it costs them. Health systems would benefit as well because, again, you're getting rid of this administrative thing that we're trying to do. Now, there's still a rev cycle component, but it's much, much simpler if you think about it. Anyways, I'd love to hear your comments. Those are my thoughts. I know there was a lot to throw at people, but I'd love to hear what your thoughts are. I'm going to continue with thinking about like ways to describe this better and maybe some other thoughts on it. Great. Hope everyone has a great week. We'll talk to you next time.